Hi, everybody. This is Dr. Ladd McNamara, and today I'm going to talk about the coronavirus, the COVID-19. We're going to go through a presentation. I'm going to show some slides that will kind of help understand it, and hopefully this will be good for you and your family. And I don't want to. It's not about fear. It's not about panic. It's not about alarmism. As a matter of fact, this is about understanding how we can get through this, and the benefit of today's presentation is going to help with awareness, and if nothing else, it can help slow and even help stop or prevent you getting the seasonal flu, which is a much more likely chance of that, and help with your support. So we're going to talk about many things, including the about supporting your immune system with quality nutritional supplements and how that can be beneficial to you. So let's go through that. Let me go ahead and shrink that down while then I start this presentation, which is on the coronavirus, the COVID-19 here in 2020. All right. So as we go through this, there's a few things to understand that the coronavirus, or COVID-19 as it's called, we're going to have some questions about it, and that is, what is it? What are the symptoms, and how different is it from the cold or the flu symptoms? And how can it be contracted, and how contagious is it? How serious is it, the death rate? Who's most at risk? How you can protect yourself and your family, and what nutritional supplements that you might want to consider to best support your immune system. With all that being said, let's go through that. The coronavirus is a large family of viruses. As a matter of fact, most colds, the common cold, are caused by coronaviruses. And it can lead to, so that's the majority of things. It can also lead to pneumonia and also respiratory distress and even death, which is what this issue is with the current COVID-19 and other ones. This is called the coronavirus due to the crown, which is created by this. If you look here, you can see that the viral particles, the RNA, this is the genetic material. It does not have DNA, but the RNA is what hijacks your cells. Hijacks your cell nucleus, DNA, and starts producing its own. Outside of the virus is called an envelope. This proteoglycoprotein envelope here. Cell membranes, it's made from the cell membranes of the host, and then it produces its own proteins. These proteins that will spike out there then under the microscope, and creates this appearance of it having a crown. Well, what this does is that these proteins, these H proteins in the crown of the coronavirus, has to attach to cell receptors. So your cells have certain receptors for proteins, and they're specific. For example, a coronavirus can be specific to a specific mammal, a bat, a goat, a cow, a dog, or to humans. And they usually don't cross species. They're usually specific to a species, unless there's some kind of mutation, either natural or bioengineered. Those can be done. So this will go directly to the receptors. If it can't attach to those receptors, it won't infect the cells. But right now, the COVID-19 seems to be it's only specific to humans and does not infect dogs or cats. And although it can be there, it won't cause any damage to them because it can't connect to their cell receptors and can't infect the cells, at least at this time. All right, so what happens is that the virus will then attach to the cell receptors, and when it's attached to cell receptors, then it can inject its RNA. The RNA goes into the nucleus, and then it takes over and hijacks the DNA for your own cells to then produce more viral particles, and those viral particles then surround themselves with some of your own cell membranes, and then produce its own proteins, and then they go off and infect more of your other cells, and then you start coughing and hacking, and you spread them out into everywhere else through your saliva and sometimes through the feces. All right, so the coronavirus 19 or COVID-19 pandemic is named for the coronavirus disease. That's what the D stands for in the COVID is disease, and of course 2019 since it started in Wuhan, China, and December 2019 is when it first broke out. And the origin of which we won't go into this time because I don't believe much of what's been told by China. I think there's much more to it than that. We'll just leave it at that. But it has 96% or so similarities, genetic and protein similarities to the SARS virus that broke out a pandemic in 2002. So therefore, now this is called the Severe Acute Respiratory Syndrome, or SARS, coronavirus 2, or SARS-CoV-2 uh, virus. So you can see it named either COVID-19, SARS-CoV-2, either one is the exact same thing. There's been other coronavirus pandemics, as I mentioned here. As a matter of fact, in my article that I'm going to publish this weekend on ladmcnamara.com, I'm going to have this table that I created, which has certain diseases, the worldwide cases, death rates in the U.S., deaths, et cetera. You can see the MERS, the Middle East Respiratory Syndrome pandemic, didn't really affect the United States much at all, no deaths. And in the SARS outbreak in 2003, you can see that worldwide it was a bigger issue, as it usually is. And then with 8 cases in the United States and 0 deaths, probably mostly due to the fact of good healthcare. But you look at the mortality rate worldwide, that's pretty significant, particularly the Middle East respiratory syndrome. It's huge death rate. Well, seasonal flu, I want to call your attention to this. Look at the United States. There's 45 million cases per year on average. Now, sometimes there'll be many more million than that, tens of millions more than that, sometimes tens of millions less than that, because it depends on of the flu, because sometimes different flu viruses have different virulence and cause more deaths. But on average, we have about 50,000 deaths per year in the United States already this flu season. There's been, I don't know the exact number, but there's, I don't know if it's 30 or 40,000, but it's a significant number already died from the flu already since in late 2019 to early 2020. The death rate on average for flu, seasonal flu or influenza, is 0.1%. That's much less than obviously than what we're concerned about now. Now, when we look at COVID-19, in the United States, as of the time of my recording, which is March 6, 2020, last I heard there was 232 cases in the United States with 11 deaths. Well, 3.4% mortality rate worldwide, but that's assuming what we're being told from China is accurate. And of course, how people are cared for in China can be different than how you're cared for, let's say, in the United States or any other country that mostly cares about all of their citizens. How many of those people in China are being cared for is not always the best and not always humanely. But if we look at it, because of I think the statistics recently from South Korea of the number of cases and the number of deaths, they looked at it, and I think the mortality rate is really being calculated to 0.7%, which is still 7 times worse than the flu, but 0.7 is a lot better than 3.4% mortality rate. So that's a huge difference. Well, the symptoms of COVID-19 are nonspecific. That means it could be anything, with a dry cough, shortness of breath, and fever being on the top of the list. I made a table, don't be confused by it, but I made this table here, which shows symptoms and characteristics of the COVID-19, the coronavirus that we're talking about, versus the common cold versus the flu. We can see that the onset of symptom incubation time can be, they said it's 14 days for COVID-19. It can be up to 21 days because some people are showing infections even long after they've been exposed. And then the symptoms come on gradually with about, so you can see that most people will have some low-grade fever. Others will have cough, but not everybody. And then some people have shortness of breath, but not everybody. So you can have one symptom, or you can have all 3 symptoms, but so you just don't know. That's how some people can have it very mildly and not even know they really have anything, and spread it to other people without even knowing. A headache is a possibility, and sore throat and malaise also. So all these are possible symptoms of it. The complications are what is really the issue here, with about 15% of the people can be really sick, And then some people, 5% get really much more sick, and then maybe 0.7% death rate. So somewhere between 0.7 to 3.4 right now is where it's at, but depending on quality care that you get. All right, so how does it affect humans? People all ages are vulnerable. And even if you don't get really sick, even if you are contagious and you think, well, it's no big deal because I'm healthy, I'm young, my immune system's great, I'm taking plenty of supplements, so therefore it shouldn't be too bad. Well, even if you get it, you can spread it to others, and spreading to others, you could kill people if you don't really take precautions and don't take it seriously. And you don't want to be known as typhoid Lenny or anything like that. So you don't want to be the one spreading it to other people. You don't want to have that on your hands. But 85% of the people will have mild cold symptoms, and that'll be that, and they don't even know they have it. So the true number of cases is probably much greater than what we're being told, because most people will think, oh, it's just a little mild cold, it's not really that bad, and therefore they don't get tested. About 15% of people will have some respiratory distress, 5% will go into heart failure, and the death rate, again, dependent on healthcare, and will be anywhere from 0.7 to 3.4%. The highest risk population, those at the highest risk are older people as their immune systems start to decline, or pre-existing medical conditions such as asthma, COPD, in other words, lung diseases, diabetes, heart disease, or people who are immunocompromised such as HIV, AIDS, or those who have taken immunosuppressant drugs for whatever reason. And then, but if you're stressed out, lack of sleep, not nutritionally sound, and don't have plenty of micronutrients, you also could have a low functioning immune system, and you could be at risk for it. So how is it contracted? Well, here's the big thing. This is huge. A lot of people think, well, I don't want to breathe in, be around people, or be infected by somebody who's, coughing out snot and everything. But at least half, if not more people, are contract the disease, inoculate themselves from coming in contact by touching contaminated surfaces or people, like shaking hands, and then touching your face and mouth and nose and eyes. That's how a lot of this is being spread. The coronaviruses in general can remain viable on hard surfaces like glass and metal for up to 28 days, depending on climate conditions, heat, etc. More heat, less likely, will not be as long, but colder climates, it can last a long time. On paper and cloth and on money, it can last for days, not just hours. It can be viable. And you touch the paper, money, and it gets on there and they spread it. So what to do about money, since many people don't wash their hands, we'll talk about that in a second, and fecal material gets on there, and the bacteria and coughing gets on the money. Your money can be really contaminated, your cash. So to do that, take all your money, put it in a plastic bag, as much of your cash as you have, put it in a plastic bag, send it to me, and I'll take care of it for you, all right? Just joking. People touch their face on average 23 times per hour. That's huge. When you touch your face 23 times per hour and you have contaminated hands, it's gonna be an issue. So there's gonna be a moral to the story. Wash your hands with soap. Breathing in aerosolized contaminated saliva, microdroplets from infected or contagious people? Yes, because contaminated saliva, the microdroplets remain airborne for 5 to 10 minutes. So if somebody coughs or sneezes or even talks, that stuff's floating around for 5 to 10, and they're long gone. But they're not long gone, particularly if you're you're closed in space like an airplane, where the air is it's just recirculated. It's going to float around and cause a huge problem, let alone all the things that they touch in the airplane. But the point is, it can be there. Sneezing can produce up to 40,000 little microdroplets, and not all of them stay airborne for 5 to 10 minutes, but the lighter ones, the smaller ones do. The really, really micro droplets do. Coughing produces up to 3,000 droplets, and same with talking for 5 minutes can produce that as well. Excuse me, I'll go back. So how do you protect yourself and your family from others? That's really what we're talking about, and others. Think of others, because we need to stop the spread of this COVID-19, and if nothing else, you're helping to reduce the incidence and spread of the influenza virus, let alone the other cold viruses. So people will be generally a lot healthier. Wash your hands with soap for 20 to 30 seconds. And I say with soap. Okay, wash your hands. We'll talk about wearing masks in a second. But Wash your hands with soap after using the restroom. 36% of people don't wash their hands after using the restroom, and including bowel movements. Disgusting. I don't know where people, and that includes adults, and that includes probably some people who may be listening. Please wash your hands with soap. Don't ever go another day without doing that, particularly after using the restroom. Of the 64% of the people who do wash their hands, only a third of those do not use soap. So now we're talking about only a third of people really wash their hands with soap. And of the ones that do wash their hands with soap, less than 1% of them wash their hands for 20 to 30 seconds. So although I always wash my hands and I always use soap, needing to doing it for 20 to 30 seconds is something that I had to adjust to, because other than when I would do surgery, of course, I'd wash my hands for much longer than that, scrub it, but just washing them more frequently to reduce that, the spread of the germs. Now, also consider sani-wiping things. Sani-wipe your home daily. Doorknobs, faucet handles, refrigerator handles, toilet flushing handles, the flushing handle. Sani-wipe your cell phones, computer keyboards, your desk, anything that you touch and other people touch. Sani-wipe your car surfaces, door handles, steering wheel, the dashboard, whatever they're going to touch. Sani-wipe public surfaces before touching them, like shopping carts, keypads at the grocery store, ATMs. Gas pumps, those metal pumps. People are using those and they have snotty hands. They got all things are on the hands and they touch it, and sure enough, then it's on you. It's living on the surfaces for hours to days. What about the benefits of a mask? Again, I'm going to have all this information in my article at ladmcnamara.com, but just trying to go over it as quickly as I can. The benefits of the mask are this. Number one benefit is that it'll help you reduce touching your face. Your dirty hands, your inoculated fingers with the virus on it to get it into your nose and mouth. That will help. That's the number one benefit. As far as preventing breathing aerosolized viral particles, a surgical mask like surgeons wear will not do that, because the viral particles can get in through the sides. The number one reason why surgeons wear the mask is to protect the patient from getting contaminated, prevent the contaminated microdroplets coming out of the surgeon's mouth from talking and breathing, getting into the patient. That's why they wear them, not to protect the doctor. If you want to protect yourself from airborne viral particles, you need to wear an industrial N95 filtration mask, or N99, which even filters out even more. But like some people who use working with woodwork or dust or fiberglass will use this. For example, there's an N95 mask with a valve on it. There's a 3M one with a valve on it. Exhale. So when you exhale, the hot air goes out and nothing comes in. That valve on it helps. So when would you wear this? Whenever you're in a really crowded places, particularly if you live in a high risk area. If you're on an airplane, you may want to consider wearing these now, because what happens if somebody's an air passenger comes down later with the coronavirus, and all of a sudden you get notified you were on that flight and you're quarantined for 2 weeks? What are you going to do? So maybe not be a bad idea to wear that. So if you think you might have the coronavirus, the COVID-19, self-quarantine, don't go out in public, call your doctor or the health services, don't go to the doctor's office, don't go to the hospital and say, hey, I think I have the virus, because now you just potentially inoculated many other people and spread it. So please be wise. Don't be typhoid Lenny. And then, unless you're having breathing difficulty, of course, if you're in a medical emergency, then you can call 911 and they will take precautions, particularly that around you. Also, if people around you have it, wear a mask, and then always cough into a tissue. Even if you don't have the COVID-19, cough into a tissue, not a handkerchief, because stay on that cloth, because then that cloth is then contaminated. Speaking of contaminated cloths, after you wash your hands and then use a towel, now that towel is contaminated too, or less contaminated because you just washed your hands if you washed it thoroughly. But so you might want to change your towels on a regular basis now, and then at restrooms. Notify others that might come in contact with you that you're self-quarantine. Wash your hands often, and then take quality supplements. Speaking of quality supplements, how do you boost your immune system? Well, you reduce stress, restorative sleep, reduce alcohol consumption, which can reduce a lot of alcohol can suppress an immune system. A lot of high glycemic foods, sugar can suppress an immune system. So eating mostly healthful, low glycemic foods is a good idea. And taking quality nutritional supplements. And this asterisk means talk to your doctor before you do anything. This is information only, not medical advice. So speaking of that, let me give you some information about supplements, micronutrients that are known to support your immune system, and many of which are known to inhibit viruses in one way or the other. First of all, things that I'm taking, a wide spectrum of quality vitamins, antioxidants, multiminerals. Fish oil, quality, potent, and pure, one of those capsules twice daily. I take 10 to 12,000 IUs of vitamin D. If you're taking between 100 micrograms to 1,000 micrograms or 4,000 to 10,000 IUs of vitamin D per day, good idea, because high levels of vitamin D in the blood are associated with decreased incidences of flus and colds. And this is a virus that's, coronavirus is very commonly known as a cold virus. Grapeseed extract, 100 to 400 milligrams twice daily, not a bad idea. I take 400 milligrams twice daily. And when I traveled, like recently to Canada and 3-city tours in February of 2020, I was taking 400 milligrams 3 times a day. And very significantly, beta-glucan polysaccharides derived from mushroom, shiitake, and reishi mushrooms, as well as baker's yeast extract. 1 to 2 tablets twice daily, not a bad idea. At least 1 tablet twice daily, because you want to know how significant that is. It was so significant that when I traveled to Canada, I was doing 3 tablets 3 times a day, particularly when I was traveling in the airplanes and through the airports. 3 tablets 3 times a daily, and then went back to 2 tablets twice daily, which is what I normally take. Speaking of the beta-glucans, how do they function? How do they support the immune system? They modulate the immune system because they will attach to the receptors on white blood cells. Let's say this is a macrophage, and it will create this to become more active and go after the bacteria and viruses and abnormal cells more effectively. For example, as you can see, is the beta-glucan polysaccharides attached on the receptors. They stimulate the white blood cells to target foreign proteins found on abnormal cells, found on bacteria, yeast, and viruses. Furthermore, it released cytokines, which signals cytotoxic T lymphocytes to go after these same things and stimulate a humoral response leading to antibody formation. And now you have further destruction of these abnormal proteins, including viruses. And these same cytokine signaling activation will activate and signal white blood cells called natural killer cells, which, nice name for it, that's what you want your cells and your dog to be called, natural killer, go after the abnormal viruses. And furthermore, the beta-glucan polysaccharides will directly activate the natural killer cells to go after the viruses, as well as bacteria, fungi, and abnormal cells. Isn't that significant? One of the things is that what happens is that the coronavirus with the spikes, it has to, again, as I said earlier, attach to specific receptors in a species. It's species specific. It attaches there to be able to inject the RNA to hijack your cell, the host cell. This is you. The beta-glucan polysaccharides appear to interfere with this bonding, this receptor site attachment. And if it can't attach, it can't infect the cells. So not a bad idea to have plenty of beta-glucan polysaccharides. Again, I'm going to have all this information with medical references in the article I'm publishing at ladmcnamara.com later this weekend. Nutritional supplements, where did we go? Nutritional supplements, additional ones, and we're almost done, that I consider taking are the that have shown to have antiviral activity as well as many other benefits. Quercetin, which is a flavonoid. It's often found in a quality vitamin antioxidant supplement, as well as it's provided in a quality booster supplement. A booster supplement. Alpha lipoic acid, which is provided in a booster supplement, quality one, as well as a quality liver support supplement. Olive extract, provided in a booster supplement, as well as a liver support supplement. All these have been shown to provide to display antiviral activity. Now, I'm not saying this will prevent the coronavirus. I'm saying that these have been shown in studies to exhibit antiviral activity. As far as is it specific to this virus, the COVID-19, we don't know that yet. But since these display antiviral activity and support the immune system and others, and it has many other benefits, what's the downside? You're not going to harm yourself and you're going to have plenty of benefit. Green tea extract, curcumin, N-acetylcysteine, milk thistle extract, all provided in a quality liver support supplement, all of which has been shown to have antiviral activity. I take 3 quality liver support supplements twice daily. When I traveled to Canada, I'm mentioning Canada because that's where I traveled in February, I took three times a day. 3 twice daily is something to consider, or at least 2 twice daily, or if you can, 1 twice daily, whatever your budget allows, but consider it. And this last one, this Pterocarpus marsupium extract containing the pterostilbene, which you have, like I said, grapeseed extract, you have resveratrol, and you have pterostilbene. Very powerful, many benefits to it. It's also provided in a quality booster supplement. It's very significant. There's been shown many benefits and particularly antiviral activity with this as well. So consider that. Again, I'll have that information. Look for that article if you want more information. Have all this information I talked about here, plus a lot more, including those tables and statistics and medical references at ladmcnamara.com. I'll have it later this weekend. Just trying to do catch up on all this, but hopefully that will help. It'll be a benefit to you. And with that,